Good afternoon, everyone. Thank you so much for dialing in. We're going to get started. Sorry, Tina, we're having some technical difficulties. Okay, here we go. So what we want to achieve this afternoon is to describe how the Simcoe Muskoka District Health Unit, which is a local public health unit in Ontario, with the support and expertise of PHO, investigated a case of mercury poisoning and subsequently assisted with the decontamination of a home following the use of a privately imported skin cream. We also want to provide information to you on how a home assessment was conducted and how this was done in the absence of documented best practices. We also want to take a little bit of time to celebrate our successes, especially those while working collaboratively with federal, provincial, and international public health stakeholders. And finally, we also want to highlight the importance of notifying healthcare providers and the general public of public health hazards identified during our investigations, particularly those associated with heavy metal poisoning, so that we hope they will assist with quick identification and diagnosis and treatment. So what this timeline provides to you is it shows a brief overview of the various activities that both Public Health Ontario and the Simcoe Muskoka District Health Unit took from the beginning of the time when we were notified of the case all the way up until the time where we conducted the first home assessment. So there was a significant amount of consultation that occurred between several agencies during this time because we wanted to better understand the scope of the problem and to determine the next steps we needed to take. So at this time, I'm going to turn it over to Vince, who will start to talk about the case.
So this all started with an email that I received from a toxicology clinical fellow from Sick Kids Hospital. And the story in the background was that there was an infant who had initially presented to their local family doctor with a gradual onset of pretty non-specific symptoms. And that included at that time weight loss, failure to meet developmental milestones, and some irritability. So nothing very specific there to go on. They had received a fairly extensive clinical workup in the community, and they were really unable to figure out what was going on with the child, and obviously the parents were quite concerned. And so they took the child to Sick Kids Hospital, where they were admitted for further workup. Among the many tests that were done, they did test for metal levels, and they found that there was elevated mercury in the urine and blood, but more so in the urine. And so then they proceeded to try to figure out where this was coming from, and they took a more detailed history, which revealed that the mother had been using a skincare cream that had been purchased through sort of privately imported, basically from Mexico, and she had recently brought it back and had been using it on herself. So though the cream was not labeled for use as a skin lightener, strictly speaking, skin lightening creams are known to contain Calomel or mercurous chloride, which is a form of inorganic mercury. And so there is suspicion that this may be the source of exposure. So Calomel, also known as mercurous chloride, is a form of inorganic mercury. And from a toxicological standpoint, the three relevant forms of mercury are broadly classified into inorganic, elemental, and organic, of which the first two tend to behave a little bit more similarly from a toxicologic standpoint. Elemental and inorganic mercury in the community are generally significantly less commonly encountered versus methyl mercury, which is the type of mercury found in large predatory fish. And Calomel has been used for a variety of medicinal and personal care products, as you can see in the photo here of a historic kit of various medical supplies, and Calomel is found in a few of them, and is used for many of the side effects that can be caused from ingesting it. So used as a laxative because ingestion can cause GI upset and diarrhea. It also has been used as a skin lightening cream and as a diuretic and an antiseptic. And because of its various uses historically, it's still found in many unregulated markets or in privately imported items. And to that end, the WHO did a review of mercury in skin lightening products specifically, and they found that the uses particularly widespread throughout the world, including in African, Middle Eastern, Asian, and Caribbean countries, and manufactured in just as many places, if not more, including in our neighbors in our backyard in the U.S. Sometimes marketed as a soap that would be used, and then sometimes instructions are to leave it on after going to bed and washing off in the morning, or as an antiseptic soap. And sometimes the product labels will even specifically say that mercury is in it. Other mercury-containing cosmetics could include mascaras, eye makeup cleansers, etc. So it can be found in labeled for a variety of uses, I'll say. And we see this both in the mom and pop stores in the communities across Canada, and there's a case report referenced here, but also online as well. And there was a case of skin lightening creams being sold that contain mercury being sold on Amazon. And so often they're privately imported, as was the case here, but sometimes available online. And as I mentioned, they can include a variety of uses and forms such as creams, gels, lotions, and soaps. So once the inorganic mercury is in the body, what does it do? It can be absorbed from inhalation or dermal contact, particularly if the skin is not intact. Ingestion generally is quite minimal, particularly for the inorganic and elemental forms, as opposed to the methyl mercury or the fish mercury, which is readily absorbed in the GI tract, or at least a lot better absorbed in the GI tract. And the target organs are basically the nervous system and the kidneys. And so I've listed some of the signs and symptoms of significant exposure, which you might recall, really we didn't see any of in the patient when they initially presented. But if you read the textbooks, and in some cases in my clinic, I've seen examples of some of this. And so in terms of the central nervous system and the peripheral nervous system, individuals can start to develop tremors or erethism, which is described as pathologic shyness. The Mad Hatter from Alice in Wonderland is classically thought to be mercury poisoned from elemental mercury from making hats. It can also cause numbness in the hands and feet, also called sensory peripheral neuropathy. There are some vascular or blood vessel effects, and that can manifest as inflammation of the gums, known medically as gingivostomatitis. Acrodynia, which is where basically an immune system reaction, more often seen in children, but not in this case, where the hands and feet become red and painful. And hypertension and tachycardia, or otherwise known as high blood pressure and heart rate. And then finally, the kidneys, as I mentioned, it can reduce the function of the kidneys, and that's what reduced EGFR, or glomerular filtration rate, or venotubular dysfunction. And generally in occupational contexts where we might see significant inhalation of metallic forms of mercury, there could be irritation to the breathing tract, so coughing or shortness of breath might be examples of symptoms. And if it's inorganic and there's a lot of ingestion, then you can get irritation of the stomach and bowels, and that can cause nausea, vomiting, pain, diarrhea, etc. So for the physicians and healthcare providers in the audience, this may be of particular interest, but so if we suspect that there's mercury in the body, how do we test for it? We use the term biomarker, meaning a media of either tissue or fluid from the body that is then sent to a lab to measure a chemical or metal of interest. And in this case for mercury, if we're looking at inorganic or elemental forms, it's urine. And if it's the fish or organic mercury form, then it's blood that we would be checking. And I note here to note that reference ranges that are seen on the lab report reflect population averages, not levels of toxicity. And so, for example, blood mercury upper limit of normal of 18.4 nanomole per liter is, as you can see, orders of magnitude below where we would see toxic effects typically seen around 500 to 1,000 nanomole per liter. And similarly in the urine, the upper limit of normal on the lab report will say 3 microgram per liter, but if a person has a level of 4, it doesn't necessarily mean they're going to have symptoms, and really, generally, we don't see in the literature symptoms until between 20 and 100 or more. So because this infant was initially tested for blood mercury levels and then subsequently the urine mercury levels, given the story, and they found that the levels were elevated in both, but grossly elevated in the urine, and this supported the diagnosis of inorganic mercury poisoning. Additional family members were tested, but no significant elevations in mercury levels, including in the mother, were observed, which was interesting. Lead levels were also checked and not elevated, and the infant was treated with, chelated just means treated with a medicine that is intended to bind and solubilize the metal to allow it to be excreted through the urine, and the child did improve clinically with the symptoms that were described. So as part of the reach out to us, when they initially contacted me, the physicians at Sick Kids wanted to know where to go from here. How do we test this cream? How do we find out who the appropriate public health unit is? How do we test levels in the home and assess if there's risk to other individuals? And so that's sort of where we came into play to help quarterback a lot of this. And so we did identify, contact, and inform the appropriate public health unit. We did arrange for the testing by the Ontario Ministry of Environment, and there are our colleagues there. It's actually now known as the Ministry of Environment, Conservation and Parks. Provided a loan of environmental testing equipment and instructions for use, which we will come to later. Provide some advice on the assessment in the residence, and of course all aspects of that, including implications for public health inspectors and safety therein, to assist in synthesis and interpretation of the data once that assessment has been completed, and then discuss cleanup and communication to relevant stakeholders. So, talking about some of the initial considerations, even though we know that we've got a culprit, or we think we have a culprit here in terms of a source of exposure, we want to make sure we're not missing anything else, which would defeat the purpose of trying to assist the family in reducing further exposure. So some other examples of inorganic or elemental mercury exposure include things like older broken fever thermometers or sphygmomanometers, which are blood pressure cuffs, and again, these would be older ones. Fluorescent light bulbs, including compact and non-compact, paints, older fungicides, chemistry sets, pigment solvents, and the traditional or herbal medicines, all known to have contained mercury in them. And in terms of organic mercury, by far the most common source of exposure would be from fish. And so in anticipating the home inspection, we also think about how would these materials been stored and used and maybe spread around the house. And so we're thinking about storage and handling, contamination of the surfaces where it might have been used or could have rubbed off of from people onto surfaces and then onto other people, the washing of the contaminated clothes and then subsequent spread to other clothing in the home, and venting from those appliances, as well as aerosolization of the vapor from vacuum cleaning and other manual forms of spreading this around. So we obtained the sample, and this is a photograph of what the cream looked like, and we had it sent to our colleagues at the MECP, where they tested it and found that it was grossly elevated with 5.6% inorganic mercury by weight, and 3.2% in the second sample, which are, basically 56,000 or so times greater than the maximum allowable concentration by Canadian standards. And so this essentially, from our standpoint, suggested this was going to be our primary culprit for source of exposure. We did contact Health Canada, and they communicated with their counterparts in Mexico to carry that information forward to stakeholders in the public. So I'm going to hand things over now to my colleague Sunil.
Thanks, Vince. So I'm going to talk a little bit about the occupational health and safety considerations that we had to look at. So the issues, some of the issues were that mercury is a designated substance under the Ontario Ministry of Labour regs, which means that beyond the standard WMIS and chemical regs, there are employer responsibilities to protect the workers who may be exposed. The regs were set with industrial and manufacturing environments in mind, where processes are typically well characterized and controls could be easier to develop. A survey conducted in a residential setting poses additional challenges. So elemental mercury and to a lesser extent inorganic forms are volatile and produce a vapor which can be inhaled or absorbed. Therefore, it's the employer's responsibility to comply with applicable regulation. And this includes performing and documenting a risk assessment to determine if there is a risk of exposure, and if so, how to mitigate this risk. So one of the solutions was that the US EPA has a mercury response guidebook, and this is for their inspectors for going out and dealing with mercury spills. And it delineates what kind of respiratory protective equipment could be used depending on known anticipated ambient concentrations of mercury. So less than 25 micrograms per cubic meter, you wouldn't be required to wear respiratory protection. And greater than 25 to 500, you would need a full-face respirator with mercury cartridges. 500 to 625 micrograms per cubic meter, you'd need a powered air purifying respirator. And for greater than 625 micrograms per cubic meter, you need a self-contained breathing apparatus. And this table here just discusses workplace exposure limits and guidelines for mercury. So 25 micrograms per cubic meter, this is the Ontario 8-hour time-weighted average occupational exposure limit. Respiratory personal protective equipment is required if this is sustained for the entire 8-hour workday. And the rationale is this is a concentration at which urine levels of mercury exceed 50 micrograms per gram of creatinine in workers, increasing the risk of tremors in workers from exposure at this level for greater than 10 years. The bottom two regs are not specific for Ontario. These are guidelines from the ACGIH. And so 75 micrograms per cubic meter, this would be a short-term exposure limit, and workers are not to be exposed to this concentration for more than 15 minutes. And the ACGIH hasn't set a short-term exposure limit or STEL for mercury, but they recommend using 3 times the 8-hour time-weighted average when there's not a STEL. And 125 micrograms per cubic meter, this is the ceiling exposure limit, and workers are not to be exposed to this level for any duration, so we would want to evacuate immediately. And again, this is an ACGH general recommendation for substances without ceiling limits, so this is 5 times the time-weighted average over 8 hours. And so we consulted scientific literature, which helped inform the risk characterization. We looked at case reports and grade literature from other relevant agencies, such as US EPA, US ATSDR, California Department of Health, and these suggested that the exposure is expected to be low. Similar cases in the southern US provided good baseline data. The context of the case was reassuring. Use of the cream was stopped months before. Other family members were well and tested normal, and the source had been presumably removed. The investigation involved real-time measurements, so action levels were communicated, such as levels of concern and when to evacuate. And so we also played a role in the environmental investigation. So one of the issues was assessing breathing zone levels of mercury in the home. And so one of the solutions is that the Environmental Occupational Health team at Public Health Ontario has an instrument loan program where a variety of environmental monitoring instruments are available for loans to health units in Ontario at no cost. We provided a loan to the health unit of a mercury tracker IP3000, which is a direct reading instrument that is able to measure airborne mercury levels ranging from 0.1 to 2,000 micrograms per cubic meter. We also provide training on the instrument to the health inspector conducting the mercury survey, as well as providing follow-up technical support and sampling strategy guidance. So another issue was assessing contaminated items and surfaces which could increase breathing zone levels and also be a source for dermal mercury exposure. So again, we consulted the scientific grade literature from other relevant agencies. The Illinois Department of Health and the ATSDR provided guidance on bagging small to medium-sized items and heating this to room temperature to determine the contamination level. Mercury levels from previous surveys were reported in published literature for breathing zone, appliances, and some personal items, as well as areas likely to be contaminated. The PHI was advised to consider living spaces, the laundry room, appliances, as well as areas within the home where the cream was applied and stored, which potentially could be the highest levels, as well as additional locations identified from the history taken. And the important point was that as much as we could look at other case reports and literature that's out there, nothing really would replace the history being taken by the PHI before going into the residence. So another issue was interpreting results, as there are no Ontario-specific guidelines for mercury levels in residences. So we had ongoing phone consultations with the California Department of Health. They have extensive experience with residential mercury assessments in relation to skin creams, and the Illinois and California Departments of Health and the ATSDR provide action levels for safe occupancy and determining whether items are contaminated. So here are some general public exposure guidelines. So at less than 1 microgram per cubic meter, no actions required. The levels are safe for inhabitants and remediation is not necessary. This is 26 times lower than concentrations referenced in health guidance values. And greater than 10 micrograms per cubic meter, so evacuation of the residents from that area or room is done until cleanup is performed. And this is the lowest concentration at which urine levels of mercury increase. So these first two levels are from the ATSDR, and they're in relation to elemental mercury spills. The next level of less than or equal to 0.2 micrograms per cubic meter, this is a targeted goal level for reduction of mercury in the breathing zone set by the California Department of Health for cases involving skin cream. So this is an ATSDR minimum risk level for exposure for more than 365 days. It's unlikely to cause measurable risk for adverse non-cancerous health effects. And the reason that California Department of Health selected this level was because of the dual air and dermal exposure pathways, the presence of young children in the contaminated homes, and the differences in vaporization of mercury from Calomel and elemental mercury. So vaporization would happen at a higher level from an elemental mercury spill than from Calomel. And so as far as action levels go for contaminated items, there's no Ontario-specific guidelines for mercury-contaminated items or safe breathing zone levels for the general public. So the ATSDR sets a level of 3 to 6 micrograms per cubic meter for personal items to remain in the home based on targeted breathing zone levels at less than 1 microgram per cubic meter. And this is based on a bagging method for small items. The Illinois and California Departments of Health have a level of less than 1 microgram per cubic meter for allowing personal items to remain in the home. And the California level was set to target breathing zone levels of 0.2 micrograms per cubic meter. And I'm going to pass it on to Lori to talk about the investigation and follow-up.
So throughout the investigation, there were a total of 8 visits to the family's home, and this occurred from the very beginning of February to April of last year. Some post-investigation activities will be discussed at the end of the presentation, but I just wanted to highlight a few items on this particular slide. And so we had our first home assessment on February 1st, and then our final one was on April 17th. There was a bit of a gap between the last day and there because the equipment did need to get redeployed to another health unit to investigate a similar situation. So some of the primary issues that we came across when we started out with this investigation was that it was extremely new to us, and not to us, just to us at the Simcoe-Muskoka District Health Unit, but also for Public Health Ontario. Unlike other environmental health investigations that we're involved with, we didn't have any guidance or best practice documents available to guide us through this particular investigation. We also wanted to understand and recognize the sensitivity of the situation. We had to build a lot of trust with the family, one, because we were going to be spending a lot of time in their home and we wanted to be seen as a welcoming presence and not to be sort of afraid that there is a governmental agency in their home for a significant period of time. And we also wanted to acknowledge the fear, nervousness, and anxiety that the parents were experiencing during this whole investigation. So to help alleviate some of these issues, we did a lot of training with Public Health Ontario, and they raised some occupational health and safety considerations for us, as well as some risks that we may encounter when we got into the home. Also, with regards to the development of procedures and documents, through ongoing consultation with PHO, we were able to develop some. There's a list here that are documented under the blue bullet. So as a certified public health inspector, generally when we approach an environmental investigation of this sort, we sort of look at three primary investigative components. So we want to look at health hazard prevention and risk management. We also want to determine if the hazard can be eliminated or reduced to safe levels. And also in terms of education awareness, we really want to build this into several aspects of the investigation, particularly in this instance, because we wanted to ensure transparency with the family and keep them up to date and aware of all the things that we were doing. While we were on site, we took a detailed case history. And so what this involved was, how was the cream used? We went through the daily routine with the mom with respect to cream application. And while we were on site, both myself and Brenda Armstrong, my program manager at the time, we sort of tag teamed this part of the investigation because, as you can imagine, we took over 100 samples the first time we were there, and we wanted to ensure that we gave enough time to speak with the mom at the time when we were there, so we wanted to ensure that we were splitting our time equally. We conducted the indoor air quality assessment and wanted to monitor particularly for mercury vapors that could be arising from various personal belongings or living spaces within the home. And again, we provided lots of education, and this was in part to reduce anxieties for the family. And then ongoing consultation with PHO occurred to ensure that we were discussing the sampling results that we were seeing. So the next several slides will highlight the results of our mercury vapor monitoring and the various actions we took throughout this particular investigation. So to begin, we did provide the family with a fact sheet which was entitled Your Home Environmental Assessment, What to Expect. And because of that language barrier that we were experiencing, we wanted to be sure that the family was aware of what we were going to be doing while we were on site. So this particular fact sheet went through the different areas of the home we would be going into, and we also wanted them to prepare several personal belongings because we wanted to use the bag method to further evaluate the level of contamination of those items. What's on this particular slide, the dark font areas were those where we observed a greater than 1 microgram per meter cubed of mercury vapor, and those were areas that we tended to focus the majority of our attention on. When looking at the results, they ranged from anywhere from 0 up to 2.9. In particular, there were two makeup bags, one registered at 2.6 and the other at 2.9. These are important because the one makeup bag, the one that registered 2.9, was the case that actually contained the mercury contaminated skin cream, and the one that was sitting very close to it was the one that was second highest. And so although in the ranges that Sunil had talked about, these could have been considered to remain in the home, but the family felt very strongly that they wanted to dispose of these items. So we weren't actually able to bag test these particular personal belongings to see what the actual levels of contamination were. And then we also measured the mother's pillow because she did apply the cream in the evenings as well. So we were curious as to what that transfer could have been. This particular item was bag tested and left in an area of the home where there was a lot of sunlight, so that could get brought up to room temperature and be more representative of the level of contamination. And I also want to note too that when we did measure the washing machine in the home, it was around 2.2. And the picture that you see here is the mercury sniffer, as we call it, in use. And so this is actually a picture of Sunil, an investigation that he had conducted. And it was quite a large machine and very heavy. It had a strap on it that we could use to carry it around the home with us. But in terms of personal protective equipment, we were wearing rubber boots with the blue color booties over top and nitrile gloves. And we wanted to ensure that we were protected because we weren't sure at that initial visit what we were going to encounter. In terms of the interventions, there were disposal of personal belongings. We also wanted to ensure there was limited access to the laundry room, as through conversations with Public Health Ontario, we knew that there could be some contamination in the washing machine itself. And then also belongings were bagged to allow for potential off-gassing and retesting. And we did direct the family not to use the washing machine. And so in preparation to the next follow-up visit, we did ask the family to run 4 to 5 hot water cycles and then add a tablet of a fresh. And a fresh is a cleaning and deodorizing product, and we thought that this may be quite helpful in helping to reduce the levels of contamination that could be in the machine. We knew that the cream substance was oil-based and it could stick to various areas, and we knew that the drum was probably contaminated at this point. So those are some of the primary directions we provide to the family, and we ask that they kept the washing machine door closed after every single cycle. So in terms of the fresh, once we got on site, we did have a look at the bagged items from the initial assessment, and the results of those range between 0.7 and 1.5 micrograms per meters cubed. The family did choose to dispose of these belongings. They really wanted to err on the side of caution and felt that they could replace these items. We did monitor several breathing zones throughout the laundry room. We wanted to look at sort of adult height, toddler height, because they did have another small child in the home, as well as the infant. So we measured areas that were close to the floor. And we wanted to do this just to be sure that if any other person did enter that washing machine area, that we were aware of whether or not there was any potential risk to their health. We then focused our time on the washing machine itself. And so, as you can recall, I mentioned that the first sample we took of the washing machine was 2.2. After using the fresh as a potential decontaminating agent, the readings raised to 25.9, which was quite significant and surprised us. And after a 15 to 20 minute time period, we did do a resample, and it was down to 15.8. So following that, we got on the phone and talked to Public Health Ontario to sort of strategize what our next steps would be. As you can imagine, this investigation was a very iterative process and involved a lot of troubleshooting, a lot of ongoing risk assessments, so we could determine what a suitable response would be and how we could reduce the risk within the home. So in terms of interventions, as it related to the washing machine in particular, we directed the family to run 4 to 5 hot water cycles and 4 to 5 hot water and detergent cycles. We did find out that the fresh product, there was some components within it that did cross-react with heavy metals, and so we hypothesized that this could be the reason why there was such an increase, and it was actually drawing more mercury out of the washing machine drum itself. And we, again, directed them not to use the washing machine in order to reduce risk. So there were about 3 additional follow-up assessments that focused on removing any more residual mercury that could be in that washing machine drum. And so for us, these hot water and detergent cycles ran across 2 visits on February 7th and February 15th. And at the time of the one home visit, the family was quite concerned about their bedroom closets again, as well as children's clothing. So as a courtesy, we really want to set their minds at ease, and we did do a small evaluation of those areas again. And those ranges of the results were from 0.2 to 0.8, so nothing overly significant. We knew that the levels were higher in the mother and father's closet, as there were some clothing belongings that the mom had identified at the initial home visit that she would wear shortly after putting the cream on. The breathing zones remained unchanged, anywhere between 0 and 0.3. When we looked at the washing machine again, we did see a decrease from the initial fresh section of the interventions that we'd implemented, and those samples on February 7th went from 20.1 down to 5.4. So once the door was open and the mercury vapors were able to be released, we did see that decrease. And then again on February 15th, after another series of hot water and detergent runs, we got to see a reduction down to 1.9. And so at this point, we had sort of crossed all the bases that we thought, and Sunil had reached out to his colleagues at the California Department of Health again to find out what our next steps could be. And so they talked about using a product called selenium sulfide to determine whether that could actually reduce the levels further. And we had a lot of questions. We really wanted to understand what levels could actually be considered safe and acceptable. And then there were some ideas thrown around about various test runs. Sunil will get into this in the next slide, but we also recommended that the washing machine was still not to be used.
So the California Department of Health recommended cleaning hard surfaces with powdered sulfur, as this combines with mercury. And they also recommended conducting several wash cycles with sulfur combined with water, or using a dandruff shampoo containing selenium sulfide in the washing machine to decontaminate it. So PHO via California Department of Health suggested several wash cycles in a washing machine with extra strength Selsun Blue. The reasoning behind it was that the detergent in the shampoo would be more effective at removing the cream residue in the drum, while the active ingredient of selenium sulfide binds to mercury. So this product had the highest concentration, 2.5% of selenium sulfide, and so that's why we recommended this this product. But after the fact, we've also found that there are some other generic dandruff shampoos as well that also contain the same amount, 2.5% of selenium sulfide. I'm going to pass it back to Lori to continue.
So following Sunil's discussions with the California Department of Health, Public Health Ontario provided guidance to us on how we could further evaluate the level of contamination in the washing machine and start to establish some strategies to reinstate use of the washing machine for the family. To test the success of the selenium sulfide product, or Selsun Blue, they recommended 2 test runs, and also they wanted to ensure that we were conducting several layers of mercury vapor testing. And so what we asked the family to do prior to us arriving to this first test run was to gather several dirty towels, rags, or old clothes that they weren't particularly attached to, and place them into large plastic bags, which is depicted in this picture on the slide. And we wanted to do this so we could evaluate at what level these items were off-gassing, so when we run them through the test run, that we could determine whether or not the detergent was effective at removing the mercury, or even whether or not there could be any transfer to any other clothes in the washing machine while it was being used. So once we had the items washed, we had to separate them into 2 separate piles, one that would be air dried and the other that would be run through a regular drying cycle in the machine itself. And so the levels that we found during this particular session were that the bagged items, so prior to washing, were at 2.1 micrograms per meters cubed. The ambient air levels through every cycle of the washing machine while it was in use ranged from 0.0 to 1.9. The washed items came out at 1 microgram per meter cubed, and then also the dried items that were left to air dry remained at 1, whereas the items that were removed from the dryer were reduced down to 0.7. With the washing machine in particular, from the previous tests that we had done, we did see a slight increase from 1.9 to 2.6, and this may have just been due to the washing machine sitting for several days, so we weren't overly concerned about that at the time. But once the cycle was completed, we did see an increase of 3.7. So at that time, we knew that it would be time to go through our second test run, which occurred a day and a half later, and we wanted to really test that effectiveness of the Selsun Blue product. So on this particular test run, from the night of February 26th, so that was the day that we'd done the first test run, up to the morning of February 28th, we did instruct the family to run 10 to 20 cycles with the Selsun Blue product. We had to be very clear with them not to put too much of the Selsun Blue into their washing machine because it could create a lot of sudsing, and we didn't want to create any issues with their washing machine since it was so close to being put back into use in their home. And so we measured the bagged items, and these bagged items were the 2 sets of towels and rags that were manually dried and put in the dryer. We wanted to see if we could further reduce the levels that we had observed. So those bagged items we initially measured at 1.7, and the ambient air, unlike the other cycles, remained at almost 0, so it was just at 0.1. The washed items were reduced down to 0.6, and the dried items were down to 0.3. So this was following the use of the Selsun Blue product. And so with the washing machine in particular, it went from 0.9 down to 0.5. So in essence, the Selsun Blue was quite successful as a decontaminating agent in the washing machine itself. At this point, the direction that we gave to the family was that they could resume use of the washing machine, but prior to doing so, we recommended additional 20 cycles with the Selsun Blue. The reason why so many cycles were requested was that the front-load washing machines, they do use less water compared to a top feeder washing machine, so that's why we need to ensure that those cycles were considered and completed. So at the final assessment, which occurred in mid-April, we went in just to evaluate whether or not the family was able to get those 20 cycles in, and sort of whether or not they had continued to use the machine since that time. So when we were talking to the family, they let us know that they were able to get 10 cycles done, and then they started using their washing machine as normal. They didn't wash any of their children's clothing. They wanted to wait for us to come back at this final assessment, so then we could give them peace of mind that it had been fully decontaminated. And so we did get it down to 0.2, which was considered a success. And so at that time, we let the family know that the risk had been eliminated and that they could resume use of their washing machine as they had done before December. So in terms of education awareness, throughout this investigation, it is quite critical for us as a public health unit to be able to educate ourselves and others of this particular investigation. So we conducted an extensive literature search and review, and we also wanted to communicate the risk to the public and healthcare providers. We did develop a briefing note for the Chief Medical Officer of Health here in Ontario, and the purpose of this was to advise him of the issue and also assess the need for local versus provincial notification. We developed additional web information, and SMDHU did decide to move forward with public notification of this issue. We felt a strong obligation to notify the public and our local healthcare providers of the case and the source of mercury poisoning, as we weren't sure whether or not there might have been other families that had similar products that they may have acquired, whether on vacation or through other private markets. So we want to ensure that this was communicated out to our residents at Simcoe Muskoka. So once the investigation was complete, we just wanted to share with you a few takeaway points. So for us, particularly at the health unit, the interaction and continued follow-up with the family was extremely critical. We built a great rapport with them and felt very welcomed, and they were able to talk freely with us about the use of the cream and sort of the fears that they had throughout the entire investigation. Public Health Ontario, as was mentioned earlier in this presentation, took the lead role in advising Health Canada of the issue, who then contacted the country of origin, and this was key in potentially reducing risk of exposure to others who may have purchased the cream in Mexico. It was also important for us to note that investigations like this really expanded our knowledge outside of traditional routes of mercury exposure. Generally, when we think mercury exposure, we think about consumption of fish, and this particular investigation was quite different. And also, we always look for opportunities for advocacy. We look at primary care and public health working together, looking at identified health hazards and how to coordinate responses. Also, the reporting of heavy metal poisoning to public health. We are quite skilled in conducting risk assessments, and being notified of these issues could be quite beneficial. Also, we look at both the benefits and risks of reportability through traditional public health channels. And in this particular instance, it worked very well. Sick kids knew to reach out to Vince, and then they knew how to reach out to public health. So it worked very, very well and was very seamless. So finally, we just have some special acknowledgements we'd like to make. And for all of us here in Toronto, we want to thank Dr. Ray Copes and Elena McIntyre. And for myself personally, I'd like to say thanks to Dr. Gardner, Stephen Rebellato, and Brenda Armstrong for supporting me to help out with this presentation, even though I'm no longer working there with them. And then also to my new employer here in Perth Public Health, Dr. Miriam Klassen and Christina Taylor. Also the physicians and toxicologists at Sick Kids Hospital, and Lori Copen and Tracy Burrow from the California Department of Health, and finally the MECP laboratory. So thank you.
Thank you, Lori, Vince, and Sunil. So we'll go to questions now. We have a few questions online. If you click on the a speech bubble icon in the platform, you should be able to read them. So I'll read them out to you. I'll give you a little bit of time to read them yourself as well. So the first question that came in, do you know if Alberta offers mercury measurement equipment to local public health units? Or maybe somebody in the audience might know of that too, if you're or I mean, type your answer into the chat box.
Okay. Could you repeat that question? It just cut out.
Oh, sorry. Do you know if Alberta offers mercury measurement equipment to local public health units? Or if somebody in the audience might know.
Yeah, I'm not aware of. I'm not aware of what they offer.
Okay, that's okay. Thanks. There's just maybe a question to the general audience too, if somebody knows in the audience. Okay, next question. Did PHIs wear a respirator in this case during the investigation?
So for us, when Brenda and I first attended the home, we did have an N95 mask that we were asked to wear. We figured based on the experiences from the California Department of Health and through their conversations with CNIL, they felt that that was adequate because they knew that the levels would not be that high. Oh, sorry. What's that, CNIL?
We didn't think that the levels, from our risk characterization, we didn't think that the levels would be that high that we would need respiratory protection. And the instrument itself, it has a wand, so you're able to like put it about 1.5 meters in front of you. So as you're entering the home, the mercury tracker is on, and it's giving you real-time readings. So you'd have an idea of what you're walking into as far as exposure levels go.
Okay, thanks. Next question. There's a few questions that this person sent, so I'll read you the first one. The mercury level in the child was at a toxic level, but not in the rest of the household members, including the mother who was routinely using the product or cream. Was there an explanation for this? Did the child have a different route of exposure than the rest of the household members, considering that the entire household had similar exposure ranging from contact surfaces to clothing from the laundry?
So that's a good question, great question actually. And we were wondering the same thing. One of the things that had come up is that these creams are sometimes marketed as a general skincare cream. And so the package may say for rejuvenation of skin or for healing of skin or that sort of thing. So the suspicion was that a couple of possibilities. One was that the mother was applying it to herself and nursing the child. Children generally, from inhalational exposure as well as GI exposure, can absorb a little more avidly than adults do. So if the child is in a breathing zone and it's on the mother's face and the child is nursing or nearby, that's one route of exposure. And the other was the thought that, and though the mother didn't say this, but one of the possibilities or things we were wondering is if it may have been used on the child as a diaper, as a bum cream, basically, for diaper rash. And that would have explained things as well, because a rash would cause some skin breakdown and increased absorption, and then a diaper on top of that would effectively provide an occlusive chamber to enhance that absorption. So that was what we were thinking may have been another possibility. But at the end of the day, the fact of the matter is that we found a cream that was obviously highly contaminated. The family had given it over to us, and so there was no suspicion, and particularly after the home investigation, that there was any remaining cream or other product there of concern. And so we kind of left it at that. So that was really the best explanation we could come up with. I'm just reading down some of the other questions here. It says, how old was the child? The child was about 1 year old. And was the child sleeping in the same room bed with the mom? Yes, the child did co-sleep with them. And the most relevant exposure route for the child leading to the elevated mercury in the kid's urine and blood sample, again, probably a combination of factors, inhalation and dermal absorption, or probably both, would be my guess, and possibly more inhalation, but difficult to say for sure, definitively. And then the fifth question, how long was the whole exposure period from importation of the product to the time the kid was diagnosed? Another excellent question. And I'm not totally sure. I think it was a few months, but Lori?
Yeah, from our discussions with the family, they had acquired the cream in around September. And by the time I think sick kids saw them, it was around December. So the cream was being applied, the mother was using it for several months. So that was just based on the communication that we had with them. It could have been longer, it could have been shorter. We aren't sure, but we know at least from September through to December.
So I'll just read the next question here. What was the recommended treatment for those exposed? So as I'd mentioned in the case, the child was treated. They were treated with a chelator. I believe it was Suxamer or DMSA, and it's a prescription drug that, as I mentioned, is binds the metal and makes it water soluble to allow for it to be passed out of the body through the urine. That is done with extreme caution in the case of mercury, because there's the potential for such drugs to pull mercury out of certain soft tissues that aren't brain and redistribute it in the body to the brain before it can be excreted. And so that would be done only in circumstances where the person is highly symptomatic and the levels in the urine or blood are elevated enough to warrant such treatment. So the rest of the family members did not have elevated levels and therefore did not receive any treatment. Do we have time for more questions? I think we do, yeah.
Yeah, we do, thanks.
I'm going to scroll back down. There we go, yeah, right there. So 2 more questions. How much cream over time was used by the family that resulted in mercury levels in the washing machine? And they say suspect high levels introduced by washing clothing, and what controls are being placed at the national levels to minimize the entry of these creams? So maybe you want to
so for the first part of your question, there wasn't a lot of cream used. To our knowledge, there was only the 2 containers that we were aware of. One was essentially surrendered to Public Health Ontario and the folks at the Kids Hospital in December. And that cream, the container wasn't completely empty. I think she was only using a small amount during the morning and at nighttime, and the other cream had not been touched at all. So there hadn't been a lot that was used, but because of the intense concentration that was found, that could have very easily contributed to the mercury poisoning that the small child was experiencing. For the second question, I'll relay that back to Sunil and Vince. I don't know whether Ray had heard anything.
Well, Health Canada was informed about this issue, and they did communicate with their counterparts in Mexico. I'm not sure of any coordination to minimize entry of these creams. It's a challenge because if something's personally imported, there's a lot of things you would have to screen for somebody. You'd have to screen for in the airport. Like mercury is not the only hazardous thing somebody could be bringing in from another country. So I'm not sure where we go as far as controls go. I think awareness is a good starting place. I think if people are aware, they're less likely to try personally importing these creams.
Okay, so question for Lori.
Yeah, there's a question for Lori.
Yeah, so I was reading it here. So to answer your question, Janine, the document that we provided the family on what to expect during the environmental assessment, we developed that on our own through consultation with Public Health Ontario. We just went through the various steps and areas of the home that we would be looking at. We wanted to let them know approximately how long we were going to be there. We wanted to let them know that we would need them to find some personal items. And we also wanted to make sure that all their windows were closed in their home so we could get an accurate measurement of potential mercury vapors throughout the home. So this particular document, yeah, we had to create everything from scratch.
Great, thank you.
Yeah,
go ahead.
Next is,
go ahead.
I was just going to read this comment from Tina Chen. Is more of a comment than a question, and they point out that levels of toxicity are extrapolated from data sets that have limitations, which is true. Experience with lead is that level of concern has followed over the decades, and now consensus there's no safe level, and that is true. There's no safe level of any metal in the body, but there is a dose response. And if you're talking about individual cases versus population level cases, those are also very different. So I, as a clinician, see individual cases, and when I see a mercury level that is above the population average, I interpret that differently than if I was looking at, CHMS data and health outcomes therein. So although all those statements are absolutely true, when I say, I guess the statements that I was making earlier about toxic levels in biomarkers versus population ranges, the only point I wanted to make is that a level found in the body to be slightly over the population average, though worrisome and should be investigated, I 100% agree, doesn't necessarily mean a person is going to have symptoms, and in most cases usually doesn't.
Great, thanks for that response.
No
any other questions? Looks like that was the last one. If you have more questions after the presentation, feel free to email me and I'll forward your questions to, actually their emails are right here on their slide, so feel free to email them directly. I want to thank you, Lori, Vince, and Sunil for your great presentation, and for the audience as well for your great and enthusiastic questions.